Just give people a few minutes to log in, and then we'll get started about 2:02. Okay, good morning or good afternoon, wherever you are. My name is Lindsay Goldman, and I am the CEO of Grantmakers in Aging. Grantmakers in Aging is a membership organization that serves as a network and resource for funders and a champion for aging-related issues and investments. With over 130 members, we work to mobilize the social, intellectual, and financial capital required to improve the experience of aging now and in the future. Today, we're going to hear from representatives of the Moving Forward Nursing Home Quality Coalition, funded by the John A. Hartford Foundation and founded by Leading Age, Institute for Healthcare Improvement, and Johns Hopkins School of Nursing. The Moving Forward Nursing Home Quality Coalition has brought together a diverse group of nursing home providers, staff, residents and care partners, policymakers and advocates, and experts to advance important recommendations from the 2022 National Academies of Sciences, Engineering, and Medicine report on nursing home quality. The coalition is in the process of developing 9 action plans that will be published later this summer, each of which will have funding and sustainability considerations. Today's webinar will discuss the report, the coalition's work to date, and opportunities for funders and providers to help improve nursing home quality. Joining me for this conversation, we have Alice Bonner, Senior Advisor for Aging at the Institute for Healthcare Improvement and Chair of the Moving Forward Coalition, Doug Pace, Senior Director of Long-Term and Community-Based Care at the Alzheimer's Association, and Tetyana Shippee, Professor at the University of Minnesota School of Public Health. I also want to recognize the Associate Director, who is now the Director of the Moving Forward Coalition, Isaac Longobardi, who was instrumental in putting together today's webinar. I'd also like to thank the John A. Hartford Foundation for supporting today's webinar. We will be making today's presentation available to anyone who wishes to view it later, including the slides and the audio, so watch for an email to be sent within a few days. We invite you to ask questions during the conversation by typing them into the question box. We will address your questions at the end of the webinar. Thanks for joining us, and now I will turn it over to Alice Bonner.
Wonderful. Well, thank you so much, Lindsay, and thanks everyone for being on this call today. I imagine it's likely that we have at least some Moving Forward Coalition members on this call, and we're very grateful for all of the participation from people all around the country. So with my colleagues, Doug and Tetyana, we're here today. We're going to give you a brief overview of the coalition and a little preview of some of our action plans that are in the very final stages of development and review, and we're going to be posting them in July. So this is hopefully to get you excited about seeing what is in those plans and the other work that people have been doing, a lot of hard work over the last year. So next slide. We want to start always by saying this work is about nursing home residents. And I know there's many people on this call who not only believe that, but you live it every day. Anything that we do is about nursing home residents' quality of life and making sure their voice comes through and that we're acting on what they're telling us in their recommendations. Next slide. So again, who are we? We came together, as you heard Lindsay say, around the National Academies of Sciences, Engineering, and Medicine report from 2022 that was about an imperative to improve nursing home quality. And our job is to take those 600 pages of recommendations and prioritize them and hone them down into just, up to 9 or 10 recommendations and create action plans. And that's what we've done over the last year. We've written action plans that will lead us into year 2 of our work. That, again, as Lindsay said, funded by the John A. Hartford Foundation. And that year 2 begins on July 1st. So we're ready to go. The purpose, as we said, is to pilot test some of these action plans. Some of them are practice-based, some of them are policy-based. And there's still a lot of work to do. So we want to be really transparent about that. We've started the work. There's a lot to build on, but now we've got a framework and we've got some real action steps we can take. Next slide. So we did not have a vision, mission, or a website when we started. We started with nothing, and we convened people. We got experts. We got people with lived experience and others to engage. And the public helped us write this vision and mission statement. They came together with us. They give us feedback. And so our vision is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. So we're working on all of those things in our action plans. Next phase. Slide. So, who are these organizations and individuals who came together? It's a very diverse group. It's people from all over the country, all the different states. And as you can see here, a variety of backgrounds. Advocates are critically important. Nursing home residents are involved in every one of our committees or our work groups, including the steering committee. And we've had over, up to or over or around 1,000 people who've signed up on our website. We keep trying to track everyone, and it's not easy keeping up. It's a fast-moving enterprise. But a lot of those people are actually providers. They're nursing home owners, operators, administrators, as well as CNAs, nurses, social workers, people who work the greatest number of hours every day with residents. And people often ask, well, how are you sharing what you're doing with the federal government? We have regular calls, update calls with CMS. We work with HRSA and Administration for Community Living and other agencies, as well. Next slide. So this is just showing you our trajectory. This is what we've done over the last year. We convened people, as I said, we prioritized within the NASEM report what people thought was most important. And again, we did that with input from the public, and we created these action plans. And now we're moving from this phase 3 to phase 4, where we are going to go out. We're going to partner with nursing homes. We're going to partner with policymakers. We're going to partner with state agencies and work together to say, okay, what can we do now? How can we test this? What do we need in order to be able to test it? And sometimes that's funding or other resources. Sometimes it's relationships, et cetera. So all of that is the phase that we're moving into now. Next slide. So I don't know about others on this call. I imagine a lot of us, like myself, have worked in nursing homes for a long time. I've had a 40-year career as a nurse practitioner, doing a lot of that work in nursing homes. We know right now things are really difficult and challenging in nursing homes, particularly with respect to staffing. A lot of staff have left. And so there's a lot of training of new staff, and just, getting people up and running, as takes a lot from the organization to be able to do that well. So we recognize this, and what we've tried to do with our action plans is make them feasible, make them possible for people to do, not increase the burden a great deal. So all of those things were what we kept in mind, all of our committees kept in mind as we developed them. Next slide. So, on the policy front, as we said, some of the changes we want to see are in practice and some are related to policy. Here's some of the policy areas that the action plans are focused on. We have an action plan that's specifically about financing and incentives for conversion to smaller home models or household models. You're going to hear me talk a little bit later about some of the actions, the policy recommendations that we have regarding workforce. And there's another policy, another group that's working on policy related to ownership data and transparency and accountability. So those are all things you'll see when you review the action plans after they're posted in July. Next slide. So as I said earlier, we have these 9 action plans, and I want to make the point that, it was a 600-page report from the National Academies full of fantastic recommendations, really strong recommendations, really evidence-based. We did not try to write action plans for all of those. We wouldn't have been able to do that in a year. However, I will say that we did identify these 9 areas that we were, told by the public and told by colleagues, these are really important things for you to address. So we've chosen to highlight 3 of those here today. Next slide. And I'm going to turn it over in a moment to Doug Pace, who's going to talk about enhanced surveyor training specific to person-centered care. Tetyana is going to talk about resident goals, preferences, and priorities and interventions related to that. And then I'll come back and talk about certified nursing assistant career pathways and apprenticeships. So next slide. With that, Doug, I'm going to turn it over to you to talk about enhanced surveyor training.
Great. Thank you, Alice. And thank you for the opportunity to be here today on behalf of myself and my co-chair, David Stevenson. So we are the co-chairs of committee number 5 of the Moving Forward Coalition. And committee number 5 is based off of the NASEM report goal number 5, which is focused on designing a more effective and responsive system of quality assurance. So in addition to myself and Dr. Stevenson, our committee is composed of representatives from the provider community, consumer advocates, culture change pioneers, ombudsman, quality improvement organization experts, and a CNA and a resident of a nursing home. Next slide. So in order to improve the quality of care and the quality of life in residents in nursing homes, our committee believes that surveyors need additional training on how to assess, report, and evaluate the delivery of resident-directed living in nursing homes. Improving the quality of care and the quality of life for nursing home residents has been at the forefront of long-term care since the 1986 IOM report and the passage of OBRA 87, which mandated that nursing homes provide services and activities to attain or maintain the highest practicable physical, mental, and psychosocial well-being of each resident in accordance with the written plan of care. So today we are 35 years past the passage of OBRA 87, and nursing homes are still woefully struggling with transitioning from a staff-directed system to one that is resident-directed, for many complex reasons, as was outlined in the original IOM report and in the NASEM reports. But we believe now is the time for bold action and swift change, not only for today's residents, but also to prepare for the future. So this slide from the NASEM report depicts the committee's vision of nursing home quality, which is that residents of nursing homes receive care in an environment that honors their value and preferences, addresses goals of care, promotes equity, assesses benefits and risk of care around balancing safety and autonomy. However, as the committee's evaluation of the evidence, they found in the report, this model of quality care is not the reality in many nursing homes today. So as you can see, this model has 3 major components: inputs, nursing home care, and outcomes. And as you can see, oversight and regulation is one of the many important inputs into ensuring nursing home quality. But unfortunately, many times the survey process doesn't fully encompass the whole concept of resident-directed living and rarely focuses on the resident, family, or organizational outcomes, and the importance of evaluating quality improvement outcomes as a crucial part of the survey process. And as the CMS State Operations Manual, which provides the guidance to the surveyors in the nursing home states, person-centered care means to focus on the resident as the locus of control and support the residents in their own choices and having control over their daily lives. This defines more than care. It defines how a resident in a nursing home wants to live. And our action plan is intending to develop, test, and evaluate an enhanced surveyor training approach to resident-directed living. Next slide. So our action plan focuses on recommendation 5B, which states that CMS should develop and evaluate strategies that make nursing home quality assurance efforts more effective, efficient, and responsive, including potential long-term care reforms. So what we're proposing is a 2-day surveyor training to a select group of surveyors in one or more states that will include training on how to assess, report, and evaluate nursing homes on the delivery of resident-directed care, including person-centered care goals, care plan documentation of resident goals, preferences and priorities, and whether or not those goals are integrated into the care delivery of the resident. This training will also include participation of long-term care ombudsman, quality improvement organizations like the Quinn QIOs, and staff and residents in nursing homes. So in addition to the 2-day training, we're also proposing an additional monthly series of 12 educational webinars focused on resident-directed living, followed by 12 monthly coaching calls with a select group of surveyors and nursing homes, again, focused on resident-directed living. Next slide. So we believe that this action plan could lead to some longer-term goals, such as expanding the training to all surveyors, or requiring all newly hired surveyors to complete the training before going into the field. And this initiative could also launch how this training improves surveyor performance over time, and then those findings could be presented to CMS, HHS, and policymakers at large. Next slide. So as Alice stated, it's been very important from the beginning of the Moving Forward Coalition to have the voice of the residents. And so we asked them to give us what they think about the current survey process. And here's some of their thoughts. Residents are generally unsatisfied with their ability to meet or talk with surveyors. They experience surveyors as unwilling to listen to what residents think is important. None of them could recall being asked whether the care plan and the things that are most important to them have actually been implemented. And surveyors do not ask them whether the care plan is actually implemented as planned. Next slide. And surveyors need to make it a safe place for people to talk to them. And there needs to be more of a transparent process around the process of selecting residents who are going to be talking to the surveyors. And the process of communicating with surveys, the process of communicating with nursing homes about the survey visits could be much clearer. So just to really encapsulate what we heard from them is surveyors need training in quality of life, resident well-being, person-centered care, and really understanding what is important to them. Next slide. So in conclusion, I want to share that we have discussed this proposed training to a few state survey agencies, and we believe that there is definitely an interest to pursue this in several states if we can obtain the funding. We have an agenda and a curriculum developed and a budget for the training, along with a plan for pre and post evaluation. So, it's important for us to remember that during the State of the Union address on March 1st, 2022, President Biden announced that reforming nursing homes is a national priority. And this was the first time in history that a U.S. president had explicitly stated during a State of the Union address a desire to set higher standards for nursing homes to make sure our loved ones get the care they deserve and respect. And recently, on May 18th of this year, the U.S. Senate Special Committee on Aging held a hearing titled Residents at Risk: The Strained Nursing Home Inspection System and the Need to Improve Oversight, Transparency, and Accountability. This hearing highlighted many issues with the current survey system, including many states having high staffing shortages and turnover rates. So we believe now is the time for action. This initiative is a great example of how a public-private partnership can improve the lives of persons living in nursing homes. This surveyor training focused on resident-directed living is not meant to replace or alter any of the current training the surveyors receive from CMS, but it's to build upon it to have that training with an increased emphasis on ensuring that the voice of the resident is front and center during the survey process. Investing in this type of resident-directed surveyor training will not only improve the quality of care and the quality of life of nursing home residents, but will also help prepare the surveyors with better tools and resources in conducting their survey activities. So thank you again for the opportunity to be here today. And now I'll turn it over to Tetyana.
Thank you so much, Doug, for sharing the important work from your committee. And good afternoon, everybody. My name is Tetyana Shippee. I am a professor at the University of Minnesota School of Public Health, and I'm honored to be co-chairing Committee 1 with my colleagues Susan and Penny. Could you move to the next slide, please, for me? Great. What our committee is doing as Committee 1, we are focusing on addressing resident goals, preferences, and priorities. And I'm excited to share our work and our action plans that we've been developing with our very engaged members who, similar to Doug's description, include diverse stakeholders from residents, CNAs, and nursing home representatives to advocates and researchers like myself. Next slide, please. And I'd like to start with a vision that we as a committee have that really guides our action plan. And what we posit is that all nursing home residents should be empowered to direct their care to meet their goals, preferences, and priorities. Yet, despite the existence of federal regulation and the consensus that residents, family members, and really all stakeholders value the importance of our residents' goals, preferences, and priorities, many nursing homes, maybe most, still lack an effective system to actually achieve this goal. And so to meet this goal and advance best practice and supports for improving the federal regulation, we as a committee aim to develop a data-supported, tech-enabled process for collecting GPPs, or goals, preferences, and priorities. I'll use that acronym GPP, documenting them in a useful care plan, and then measuring the degree to which the care provided actually meets the stated GPPs. Next slide, please. Our goals and our work as a committee are aligned with the NASEM report, and I'll just give you an example of a couple of specific recommendations where recommendation 1A explicitly states that as a critical foundation to operationalizing person-centered care that reflects resident goals and preferences, the committee recommends compliance with regulations for person-centered care. Regulations are there, but the compliance is often what's lacking. Or the recommendation 6C that states the U.S. Department of Health and Human Services should fund the development and adoption of new nursing home measures to care compare related to implementation of the residence care plan and receipt of care that aligns with residents' goals and the attainment of these goals. Next slide, please. So what you see here, and I know there is a lot on a slide, but I will walk you through the model, is the logic model that we developed as a committee to document kind of visually what we see as the impetus for our work and the outcomes of our work. So let me start you on the far right part of this logic model. And what you see on the far right is the box labeled outcomes. And really what that is we identified the ideal outcomes that are likely to happen if the person-centered care planning is done correctly, if it's done as it is intended. And so what are some of these outcomes? Well, if the person-centered care planning is done as it should be, resident personhood and identity would be prioritized. Residents and family members would feel included and empowered. Resident preferences would be used daily. There would be continual preference, measuring, and monitoring, as well as staff would feel included and empowered. So that's the outcomes if the PCC, person-centered care planning process, is done as it should be. Now let's move to the next bucket here you see two columns here, and we labeled them as people and environment. And I think all of us here on this call, whether you're working in a long-term care setting, you know somebody who is receiving care in a nursing home, or like myself, you study long-term care delivery, we know that who is involved in care planning and where care is being delivered matters. And we recognize that people who are delivering care, location, time of day, all really matter to residents. So we're sort of putting them out as important aspects of this process. And we also recognize that at the heart of the person-centered care planning process is really listening and responding to residents, family members, and staff at all times, not just when these care plans are being developed, maybe at admission or quarterly, but really it should be happening all the time. But even as we say this, and we recognize that these should be ongoing conversations, we acknowledge that as these informal conversations are important, the formal care planning process is critical to regulatory compliance. And that's one of our goals, right, as a committee, is to improve that process. We posit that we need to formalize these conversations, document them well, and make sure that they're implemented consistently. So document them well, assess them, document them, and make sure that the implementation is happening as intended. So I'm kind of walking you through these pieces of documenting and using assessment in daily life and care, and then measure, monitor, and reassess preferences, because we recognize that people can change their preferences, right? Some of my own work shows, well, okay, people's preferences change. That's natural. That happens in any care setting. And why shouldn't it happen in nursing homes? And hence, it is important to ensure that that reassessment is also included in part of the process. Okay, and now let's move to the far side, to the left side of this logic model. And this is where we asked ourselves as a committee, we said, okay, we know what are the ideal outcomes we're trying to achieve. We know that there are these pieces of the process that matter, the people and environment, the assessment, documentation, and reassessment. But what do we really need to make sure that this happens? So in other words, what are the critical factors that are essential for these processes to succeed? And we identified for now at least 4 critical factors that we are including in our action plans. And the first one is that even when you have this ideal process of assessment and reassessment, the first key step that needs to happen is the provider needs to know their own strengths and weaknesses, and what we're labeling here organizational self-assessment. They need to know, where do they need to improve, what's going well, what's not going well. Maybe they've had really good conversations, but they are struggling with follow through. So the documentation is happening, but implementation is lagging. Maybe because it's mainly paper-based, and that's one of the barriers. Or maybe it has been pressed, the provider has been pressed to do comprehensive training or fully include families. Or maybe residents are not consistently included or present in a way that's okay with them. So we believe that organizational self-assessment is one important key factor for success. A second important factor, and we really heard this from residents who indicated that they want competent, trained workers. And so training in a number of factors, I saw in comments, discussion of ageism, as well as other really essential pieces for person-centered delivery of care need to take place. And then we need to orient everyone to the person-centered care process, right? We need to orient residents, families, and staff to our updates that we make, our processes, structures, and goals. And then finally, I would argue that for all of this to succeed, the infrastructure for measuring and monitoring is really, really important. And to do this work, we are partnering with committees 6 and 7 that are focusing on health IT and quality improvement processes to ensure we're working in partnership, even as we develop these processes of assessment, that we're also thinking about the infrastructure. And so when you look at this figure, 2 pieces I haven't mentioned yet are these 2 arrows that are connecting it all together. And really, this is about the ongoing quality improvement. Because we believe that, again, continual feedback loop across all of these categories, across all of these domains is really, really essential, which I know is easier to say in words or for me to represent, with a circular arrow, but is very difficult to carry out in daily operations, and yet is so, so important for effective delivery of person-centered care. And so really what we are contemplating at the moment, what you will see if you're going to download our action plans, which will be posted on the website here shortly, one of our goals is the development of what we are calling a guidebook. And the goal of that guidebook is to support providers in shoring up their care planning. It will include a curated repository of different tools, resources, trainings, and programs that would accompany the guidebook so that providers can choose themselves on which resources best align with their self-assessments and frankly, with the needs of their residents, because we know that resident needs vary so much from site to site, as well as their own philosophy and culture of care. Next slide, please. And so to conclude, let me summarize our action plans here that you saw in the model. We aim to compile existing care planning assessments. We're doing a comprehensive literature review so we could see the evidence base around different assessments. We're not making a recommendation on one ideal assessment, but we want to provide the tools for providers to choose which of those assessments works best for their culture and delivery of care. We want to refine the definitions of goals, preferences, and priorities. As I noted, we will work with different committees, with committees 6 and 7 in particular, to do measurement of continuous quality improvement, health IT integration, as well as separately working on designing a guidebook for high quality care planning. As I noted, we will include a repository of various resources, tools, and trainings, as well as resources for gaps, maybe on person-centered personhood training or orientations that certain sites might want to uptake. And to do this work, we're moving very quickly that in the winter of this year, we're going to recruit nursing homes to test these care planning processes, guidebooks, and resources on what's helpful for them or what might still be missing. And we'll be recruiting about 4 to 6 nursing homes to do so. So again, thank you for your time. Your support and resources would be essential for this work, which I believe is much needed and would be an essential key step to really move from having the documentation of these policies in federal legislation to implementation and making sure that we're really promoting quality of life for residents. Thanks, and I'll hand it off to my colleague Alice.
Wonderful. Thank you so much, Tetyana. That was a great overview. You did really well with that, that complicated slide. Next slide, please. So I'm going to wrap up our presentation portion and we'll get to discussion. We're going to have plenty of time for discussion today. I'm going to talk on behalf of the committee that you see listed here, which is co-chaired by Jasmine Travers and Kezia Scales. And one of the action plans that they developed, which is on CNA career pathways. And I will just start by saying, when we reach out to the public and we ask for feedback, the number one thing that they say to us all the time is, please, if you do nothing else, please help us think through the current staffing shortages that we're facing right now, because we don't know that we're going to be able to do other things until we really address the staffing issues. So that's what we tried to contribute to in this action plan. Next slide. So this is just, again, I know this audience most likely is very familiar with this, but not everyone is really somebody who does a lot of work in nursing homes. You may work in home and community-based or other settings, but in nursing homes, certified nursing assistants, I'll use CNA from now on, are the individuals who spend the greatest number of hours every day, evening, and night with nursing home residents. They deliver the direct care, working with RNs, LPNs, social workers, physicians, et cetera. So this is what people said to us, though, is so critical right now, is dealing with a need for CNAs. Next slide. As Tetyana and Doug both did, we're going back and saying this is what was in the NASEM report that led us to focus on CNAs, and in particular to focus on wages and benefits and the development of a true pathway. And this is an important point that we learned, which is a number of states have programs for CNAs, but they're really entry to practice programs. They're programs where it gets people who want to become a CNA to get into a training program and then get into the, get employed. But there's something else that's really important to distinguish, which is a career pathway where people who become a CNA imagine how they can grow in that role. They can grow to become a director. They can grow to become an educator, et cetera. So that's what we're talking about here, just to make that distinction. Next slide. So this is just to show you there's different ways that that you can get at a career pathway for CNAs. On the left-hand side of the slide here, you see that you can get training for certification through a registered apprenticeship program, or a RAP, and I'll talk more about that. In the middle, you can see that if you're already a CNA, you can get into a a better career pathway for yourself that does not involve an apprenticeship program. And then the one we really wanted to spend the most time on today is a career pathway if you're already a CNA and that goes through a registered apprenticeship program. And again, just to be clear, some of the terms on here and some of the organizations you may be familiar with, some you may not. EQUIS and HCAP are called industry intermediaries. You may know about them. You may do some work with them. Those are organizations that work closely with the Federal Office of Apprenticeships. And I'll say a lot more about that because that's one of the things we found out in our work is a way for states and nursing homes to get support for doing these kinds of apprenticeships. So organizations that are industry intermediaries can provide administrative support, they can provide technical support, and some of that can lead to lower cost, and that's important. Next slide. So we have a couple of slides just to show you. These are from the Federal Office of Apprenticeships. So these are not our slides. We're showing you that there is a structure for this. And, apprenticeship programs can be time-based, they can be competency-based, they can be a hybrid. But, there's ways that we've got communication materials that are already developed that can really highlight the benefits of these types of programs. Next slide. So this is a busy slide, but I think it's important. We wanted to share that, across the country, there are different ways that people and states can get support for these apprenticeship programs. Some of it is coming from the Federal Office of Apprenticeships. Some of it is through state offices that work closely with the federal office. What's also really important is there have been a few reports, and again, I'm happy to share these with GIA and they can post them or share them with all of you. But back in 2011, which I realize is a little bit old now, there was a report by RTI and the Urban Institute that highlighted about 5 state programs and what they did to promote more people becoming CNAs through these apprenticeships. And it was states like Idaho, Texas, Indiana, South Carolina, and Pennsylvania. Since that time, there have been many more states that have developed other types of similar programs, California, Missouri, and others. So you may live in a state that has some of those programs, or maybe a state that does not. But it's important, again, to make that distinction between, is this just an entry to practice to get people into the pipeline, or is it a program that really enhances and expands career pathways for CNAs? The other policy brief that came out much more recently, within the last year, was from the Centers for State Government, or CSG. And that report on pages 36 and 37 has some very good examples of state programs. So we'll make that report available to GIA as well. Next slide. So again, another slide from the federal office. How do we get people to want to do this? How do we get them to want to work in nursing homes, to think that that could be a career opportunity, not just a job, a career? And so these are examples of, some of the things that we can say that might incentivize people to get into the pipeline. And again, the pipeline is only the first step. It's really about retention, reducing turnover, all of those things that can be outcomes with apprenticeship programs and CNA pathways. Next slide. The Center for the Office of Apprenticeships has interviewed a lot of employers, and we wanted to make the point that these programs are really employer-based. They're not regulatory. We're not going in saying, the state should require this, although that's an approach that might have merit, and we talked about that too. But these are some of the things employers, nursing home owners said about being involved with these apprenticeship programs and what it did to benefit the lives of people living and working in nursing homes. So again, very important that there are resources out there that have already been developed. So part of, when we're thinking about, who might be interested in supporting some of these programs, part of it is saying, we've got a lot that's already been done. We've got good things that we can build on. And that it sort of gives us a jump start to do some of these things in individual states. Next slide. Just an example happens to be from South Dakota. This is what their website looks like for their nursing workforce center. And many, many states have a nursing workforce center. Some of them are supported by state funding, but important to know in any particular state, is there a center for workforce, and what are they doing on specifically the long-term care or the nursing home workforce? Next slide. So in addition to the, Center for Work, the Nursing Workforce Center, there's other organizations within states you all are familiar with that are very important. The Department of Labor, Department of Education, HHS, Health and Human Services. When those organizations come together with the Center for Workforce and others, then we can really see things start to happen. So in wrapping up, we would say to you, there's a lot of great work already that's being done. CNAs are critical to the workforce. They have to be well trained and supported. And there are resources that we can share and information in the reports I mentioned that will make sure we get to GIA. And individual states could do a small demonstration, a small pilot, and build on some of the work that's already been done and test some of these workforce outcomes. How did it work? And can we move forward from there? So again, next slide. I think we are just going into questions and answers. I'll go one more slide after this, just to share with you that, we wanted to say thank you for being on the call today. And we want to find a path forward together because the coalition is built on the shoulders of people like all of you listening today. So we know we've got a path that we can find, and we'd love to continue to have all of you engaged in that and encourage you to visit our website. The action plans will be posted in July. So Alice Daniels, if you want to go back to the previous slide, that's question and answers, or if you want to take down the slides for the Q&A, then we're happy to do that. So I think, Lindsay, we go back to you first.
Yeah. So I'd love to invite all of our speakers to turn their cameras back on, and we'll get into some interesting Q&A and discussion. I'd like to invite the audience to submit a question using the Q&A button. I'm thrilled that we've had a really lively chat during this session, which certainly makes things more interesting. And so I want to start by saying, thank you so much for your presentations today. It's really timely that we talk about nursing homes, and I think that they often do get excluded from conversations, from planning initiatives, and sometimes from funding opportunities. And, in a lot of ways, the reality is that funders also help to reinforce this kind of siloing of nursing homes by creating sort of false dichotomies and categorizations of, this is a pot of money for community dwelling older people, and this is a pot of money for, nursing home dwelling individuals, when in reality, nursing homes are in communities, and there seems to be sort of a lack of recognition of that fact, and also of the fact that we're all aging and we're moving between settings, right? And so maybe today I'm living in my house, and tomorrow I break a hip and I'm, in the nursing facility. And so I'm curious to know, did the coalition talk about how we might better integrate nursing homes into communities and the larger healthcare system, which we also know is associated with better quality care at every stage? Were those conversations that you had?
So I'll start, and Tetyana and Doug can certainly jump in here, because I think all three of us have had those conversations. I would say it has been for years that nursing homes have been nearly invisible to public health, to the Division on Aging, to the governor. That's how it's been. And so we collectively, everyone on this call and all of the 1,000 people who signed up to do this work with us, plus many others, we have to change that, which is we're well past time to change that. So yes, we talked about that. We actually formed a cross-committee work group in the beginning because we wanted a group that would really just focus on, where nursing homes fit within the community and fit within public health. I've worked for public health. Tetyana is at the School of Public Health. Doug has done a lot of public health in his career. So I do think it's important. But Tetyana and Doug, what would you guys say as well in your conversations about fitting in the community?
I don't know that I have much to add to what you shared, Alice, other than reaffirming, Lindsay, that I'll say as a researcher, and now I've been doing this work for a while, but even as I started as an assistant professor, and I'll share a little factoid about myself. I spent 2 years living in a long-term care facility as a doctoral student, so early 2000s, and really understood from that resident goals, preferences, and priorities are vital, and dedicated my research career to doing this work. I was warned by multiple funders and mentors not to go into nursing homes because there is so little funding for this area. And yet, I'll just put another key plug. When we really think about people who are staying in nursing homes, especially long-term, those are some of the most vulnerable older adults we have in our country. We know that the proportion of people from communities of color is growing in nursing homes, disproportionate to that in a community, in part because there are no other places to go. We know that the case mix of people in nursing homes is really growing, and we know that they provide vital care. And so I would argue that it is past due, and we're all here agreeing that we focus on nursing homes as part of a community. And you're right, people go in transitions of care. You're coming in for post-acute stay, you're leaving, you're coming in potentially later for longer stay. And that is a broader kind of vision as our committees are working with each other, where, even in my presentation, I shared that, yes, we're focusing on goals, preferences, and priorities, but we're partnering with other committees on how we do health IT for that, how we build infrastructure. So to Alice's point, that's a broader kind of coalition vision and conversations across committees. I don't know, Doug, if you have anything to add.
Sure. Yeah, I would just add, we know that nursing homes play an important role as the part of the continuum of care. And as Tetyana mentioned, we know a lot of those long stay residences. Our facts and figures report from the Alzheimer's Association states almost half of them are persons living with dementia. And it's so important that we have a system, and that's one of the things that we look at in the Moving Forward Coalition, is to make sure everyone has a voice, and especially those persons who can't always communicate their needs in the way that you might expect that, to make sure that we have the tools and the resources there for them, and to make sure that we have a staff that's trained on how to really best support, know that person, meet them in their reality, and to give them the best day they can have.
Thanks so much for those really thoughtful answers. And Doug, that's a perfect segue to one of our next questions, which is around how will the action plans take into account some of the specific needs of different groups? So one of the groups that was mentioned was people with dementia, in terms of the workforce training, in terms of surveying and person-centered care. And then another question came in around veterans. What's truly required to improve the quality of care delivered to veterans? And we could plug in, other populations. And so I'm wondering, just more broadly, how can we tailor these action plans to ensure that there's a sort of baseline of quality that can be adapted to meet the unique needs of individuals?
Well, I'll start quickly and then turn it over to Alice. It's certainly for people with Alzheimer's and other dementias, as I said, and as we state in our dementia care practice recommendations, it's important to know the person. And, one of the most important ways you can do that for the staff, and especially those frontline caregivers, is to give them the tools and the resources to see that there's a better and different way for them to provide care. And it's talking about using every engagement that you have with that person for an opportunity to make a connection, not just to have a checklist and to do something that's easy for them to do in the moment. It's really about having that holistic look. And even though that person might not be able to vocalize their needs, to be able to know that person well enough to know what makes them happy, what brings them joy, maybe what upsets them. And really, that's a core part of this training, is to really meet people where they are.
Right. And the final thing I'll just say is, the training for surveyors and the training for and with nursing home teams they just go hand in hand. And, Doug's been, saying that throughout the course of the development, is we cannot keep separating, surveyor training and all of that over here in one place and provider training over here. It's got to be one system. And yes, the surveyors are overseeing, it's the oversight of the system, but it's still one system. And interestingly, as Doug presented in his slides, the residents have a lot of thoughts about the survey process. They want to be more involved. They want to be chosen if they want to speak up, and they don't understand it and they want to understand it better. So, and I would say the same thing about family members. So I think we've just got to get out of our silos and have more inclusive conversations and not let old ways bother us. We've got to say, well, that we're not in that century anymore. We're going forward, and we need to do better.
And so, based on what you've just said, because I totally agree with you that we've been operating in silos, we need to stop. We're starting to see some momentum at the national level and also at the state level on aging related issues, particularly around family caregiving, right? We have a new national strategy on family caregiving. We have a new national framework on social isolation. And I would argue that isolation is a major issue in nursing homes. So how would you say that nursing homes have or have not been integrated into these other national strategies where there's clearly some overlap?
We are fortunate, I believe, that we've got several members who are part of national caregiving or state caregiving organizations, really, really bold, courageous, thoughtful, dedicated people who have just given their lives to these issues and are still doing that. So people in Texas, people in Connecticut, people all over the country. And so, caregiver support and enhancing training and the integration of caregivers into our work is critical. Again, one of the groups that has for a long time been virtually ignored in some nursing homes. And let me just say, there are some wonderful nursing homes out there. So this is not to paint a broad brush at all, but in some cases, family members are not taken advantage of the way they want to be supporting the quality of care and quality of life. Again, you mentioned about social isolation being a huge issue. It is still a huge issue around the country. You guys know that, but not a lot of people outside of nursing homes know it. And so, having volunteers, having people from the community come in, having care partners come in is vital. So Tetyana or Doug, what would you add to that? Because you guys are even closer to the caregiver work, I think, than I am.
Well, I would just add that, I think it's important to know that we, all of us are building off of previous work. It's not like we started with a clean slate and said, let's figure all this out. A lot of this work has been ongoing. And I think the exciting thing about the Move It Forward Coalition is, number one, having Alice leading this effort with all of her experience to really help us make a difference and to build off of a lot of the other previous work that's been done. For instance, around preparing surveyors to better assess more resident-directed living. In 2008, Dr. David Stevenson, who's the co-chair of this committee, did a really important study in the state of Rhode Island that proves some excellent results. So I think one of the things that you will see as we publish our action plans is we're going to reference all of those other materials that really have helped inform our work today.
Agreed.
And so let's talk about the money now. What are some initiatives or recommendations that you think are particularly well suited to philanthropic investment or to public-private partnerships that our members should be aware of moving forward? What should we be looking for when we're reviewing these action plans with an eye towards investment?
So I'll start, and then these guys can jump in. I think, part of it is, as a philanthropy, what are your core areas that you fund, and what are the core topics that are of greatest interest to you. That would be one thing. And related to that is, you know, geographically, I mean, there are some funders, maybe some on this call, who fund in certain geographic areas, but not in others. And that can be a good thing for these types of action plans. For example, there's a lot of unique issues with rural nursing homes that don't exist in urban and suburban settings, for example. So a lot of rural nursing homes are closing, small independents, nursing homes that have traditionally delivered very good care. And so there might be some opportunities to study enhancements in the quality of life in those nursing homes. You know, we have an action plan that you'll see that's related to improving resident councils. And, you know, nursing homes are required to support and provide services to support resident councils if the residents want to do that. And a lot of nursing homes they've told us that they're not there yet. They're not in compliance, but they would like to be. So that's an opportunity of, you know, it's not a huge heavy lift to do that. There are ways to do it. So our action plan has a guide and a handbook and step-by-step resources that others have developed, you know, in part. So again, standing on the shoulders of other organizations, but, you know, that might be something that would be worthwhile. So Tetyana and Doug, you know, maybe say more about the action plans you guys are working on.
Yeah, you know, agreeing with Alice, it's hard for me to select something. Of course, I want to pitch our action plan because, you know, we've dedicated, all of us are so passionate about it. But I think the key for me here is that really all of these action plans are interwoven. It's not like we're working in silos, because if we were, we would just be contributing to the current problem. So, hey, there are all these multiple reports and maybe not much is happening. So obviously, I believe that documenting, assessing, reassessing, and implementing resident goals and preferences for care is vital to residents' quality of life. You know, and I use the term resident. I'm mindful that there might be, you know, other terms here, but I've used it always because I think about that for many people who are in nursing homes, especially long stay, that is their home. They're a resident of this home. It should be a home. And so certainly when we live in our homes, we want to have our own preferences implemented. And so I would argue that what we've done with our action plans, and I know Alice has really steered all of us, is to focus on feasibility and actionability, right? There are some things that are more like, okay, it will take maybe several years or decade, maybe hopefully less to reach. But I think for all of our action plans, I'll speak for Committee 1, we focused on things that could happen now, that can happen soon. And so there would be a clear return on investment, and we don't have to wait 10 years to develop something. We already have the tools. Let's rank them, let's compare them, let's tailor them, let's use them.
Yeah, and I would just add for our committee, you know, one of the things that we know is that CMS has a very rigorous program to train their surveyors. But we also hear that, you know, a lot of times that there needs to be more to help prepare them. And we know that some states currently do that they go above and beyond what their surveyors get. And so we just think it's a wonderful opportunity for a public-private partnership to build upon what CMS is doing, but to really focus on the locus of that person having control in their lives and to help the surveyors better understand how in their survey activities, they can really understand if that's happening as part of their survey.
Thank you. Quick question for you, Alice. If people on our call today are interested in exploring, initiating or implementing an apprenticeship program or some other kind of CNA career pathway initiative, what are the first steps? Where do you go to learn more about this?
So I just chatted in my email, and I am happy and delighted to hear from anyone and everyone who's interested. I will, however, include our wonderful colleagues, Jasmine Travers and Kezia Scales. Kezia is at PHI, I'm at PHI, and Jasmine is at NYU School of Nursing, and they both do national work. You know, part of it is what state are you in? That's first question we'll ask, and then we'll say, okay, let's go to that state's Center for Nursing Workforce. Let's see what programs already exist. Some states have a lot, some states don't. And then from there, okay, and how do we connect to the Federal Apprenticeship Office, et cetera? But we are literally here to do that work with any state that's interested. So We're a not-for-profit. We're here for the greater good, and we would love to work with anybody on that. So there's my email. Feel free, reach out. Would love to hear from anybody.
Thank you so much. And, we're getting to the end of our hour, so I really want to close in just expressing my gratitude to Alice Bonner and Tetyana Shippee and Doug Pace for being with us today and sharing your expertise. I'd like to thank the John A. Hartford Foundation for supporting today's webinar. As a reminder, we will be making today's presentation available to anyone who wishes to view it later, including the slides and the audio. We'll send out a follow-up email with links to the various reports that were mentioned, as well as the action plans once they're released. So watch for an email to be sent within a few days. Please follow us on social media, and please complete the brief survey that you'll receive after the program. This really helps us to improve our programming. Please join us for our next conversation on July 6th, titled Advancing Age-Friendly Public Health, Learnings from Michigan and Mississippi. More information can be found on our website. If you are a funder, please register for the GIA conference, October 17th through 20th in Austin, Texas. Registration has just gone live. And finally, thank you all for participating in our webinar today. Please be well.
Thank you all.